We reported on the so-called tripledemic of viruses predicted to hit our area this fall. Now, as expected, hospitals are bracing for a surge in RSV cases. Dr. Nidhi Kumar is on call with the latest on this respiratory virus. She joins us now. Good morning to you, doctor.
Good morning.
Now, some say it's like having a cold, but other families are experiencing a much rougher virus. What is RSV, and why are we seeing an uptick in cases right now?
Well, RSV stands for respiratory syncytial virus, and it can cause pretty severe disease. Now, the virus is really following its natural course where we start to see an acceleration in cases that occurs in the late fall. Two big things around this virus. First, it is incredibly contagious, not only spread by respiratory droplets, but also contact with infected surfaces. And second, COVID also plays a role here. We have a large population of young children, younger than the age of 3, that are immunologically naive. Because of the social distancing, the masking, the closures of schools during COVID, they were never exposed to the virus when they were younger, and now there's sort of a catch-up going on.
There are new treatments to help manage RSV. What are they? Who should get them?
Earlier this year, the FDA approved a vaccine for patients over the age of 60 and pregnant patients who are 32 to 36 weeks in gestation. And there was a lot of excitement around a monoclonal antibody. A monoclonal antibody delivers direct antibodies to the patient. This was approved by the FDA for patients who are 8 months or younger, or high-risk patients ages 8 months to 19 months. But here's the problem. There's been a major shortage. So supply has not been able to keep up with demand. In fact, the CDC just issued a report to healthcare providers to really prioritize the most at-risk patients at this point, which are infants 6 months or younger, or those that are immunocompromised.
Now, why is it so important for pregnant women to consider getting vaccinated?
Well, this is a special population. When a pregnant woman contracts RSV later in the pregnancy, it can result in preterm labor or low birth weight babies. But the most compelling reason for women to get vaccinated is because when a pregnant woman gets vaccinated, she does pass on that immunity to her baby. So if you have a baby that's going to be born during this RSV season, really important to get vaccinated because that baby will effectively be immune.
Now, what are the considerations to make? I mean, what are the symptoms to know when to get to a hospital that you really have an emergency on your hand?
Right. So, look, the two biggest concerns with this virus are the development of pneumonia or bronchiolitis. Bronchiolitis is inflammation of the small airways. And the way that presents are shortness of breath. And it's sometimes, it's hard to really gauge shortness of breath in an infant. So you want to look for signs like wheezing, like nasal flaring, using the ribs or the belly to breathe. This can really can signal that there is severe hypoxia, low oxygen in an infant. Obviously, if there is a high fever that is persistent for more than 3 days, or signs of dehydration, then it's time to really reach out to a healthcare provider. Because again, a lot of people say that it's just like the common cold, but I was in the ER last night, St. Peter's University Hospital, and I saw a lot of young babies with pretty severe breathing difficulty from this disease.
Dr. Nidhi Kumar, we really appreciate it. Thank you very much.
Thank you.